Welcome to Fast and Furious MCQ Edition.
Let's learn about the WHO classification of vitamin A deficiency. Now, the vitamin A is required for the epithelium, generation of epithelium and maintenance of ocular epithelium. If there is deficiency of vitamin A, it leads to a condition called xerophthalmia. Here, xero stands for dryness and ophthalmia is that eye affected. And in the classification, WHO classification, we have 8 classification, that is XN, 1A, 1B, 2, 3A, 3B, S and F. Up to 1A, it is due to the conjunctival changes, and remaining 2, 3 and S are due to the corneal changes. And first starting is the XN, or the N stands for night blindness or nyctalopia. The pathology is due to when the rhodopsin, which is the photoreceptor of dark adaptation, that is rhodopsin, is affected. This leads to this is the first thing to be affected in vitamin A deficiency, and that leads to the night blindness or nyctalopia. This is the most common symptom of vitamin A deficiency. And the X1A is the conjunctival xerosis. Xerosis means dryness, and 1 here A stands for, and the pathology in 1A, so A stands for alteration of conjunctival epithelium, and which leads to the dryness, loss of goblet cells which secrete the mucin gets decreased, so which leads to dryness or conjunctival xerosis. This is the most common sign of vitamin A deficiency. And 1B here, V stands for white dot spot. This, as the conjunctival xerosis continues and the conjunctival epithelium is hyperkeratinized and forms a plaque-like thing, that is called the white dot spot. Here B stands for white dot spot. It is the most common pathognomic sign of vitamin A deficiency, and the pathology is due to the keratinization. And here 2 stands for corneal xerosis. Remember that in the eye vitamin A deficiency, first thing to be affected is the conjunctiva, and the second thing is the cornea. Here the first thing is conjunctiva, next the second thing will be cornea, as the staging also be like that. Here stage 1 is due to the conjunctival changes, and 2 is due to the corneal changes. X2 is the corneal xerosis, corneal dryness, and 3A stands for ulcer formation, corneal ulcer. Less than 1/3 it is corneal ulcer, and 1B is more than 1/3 of the cornea is affected. Here, and S stands for corneal scarring, and F stands for xerophthalmic fundal changes. The pathology is due to when the retina is affected due to vitamin A deficiency, then it is called the xerophthalmic fundus. These are the stagings of vitamin A deficiency, in that the first 1A, 1B and 2 up to the corneal xerosis, these are reversible. These are reversible diseases. Once when diagnosed and treated with appropriate dosage of vitamin A, within 4 weeks, up to the level of corneal xerosis can be reverted. But the 3A, corneal ulcer and corneal scar and the fundal change, or the irreversible changes due to the vitamin A deficiency.